Hi everyone, my name is Lauren and I'm a counsellor at the City of Glasgow College. As part of Black History Month, I'm going to be talking to you about racism and mental health. So first of all, the City of Glasgow College is such a diverse environment, and I believe it's so important to talk about racism and trauma and mental health. For any community that experiences discrimination, the emotional fallout of this can be highly distressing and really traumatic. It can lead to higher rates of anxiety, depression, and post-traumatic stress disorder. Racism can happen anywhere. It can happen at school, at work, at college, or even at home. It can happen online or outside. It can even happen within families and within friendships. Sometimes it's really obvious and we notice it straight away. Verbal abuse about the way someone looks. It can be stereotypes about how someone might behave, or in extreme cases, physical violence and bullying. For example, sometimes racism are even part of the structures and systems that we live in society. Sometimes it's subtle and difficult to notice, and sometimes it's really, really obvious and easy to see. The important thing when we experience racism is to notice the way that makes you feel. I know that we can spend a lot of time wondering if it is or isn't racism, or if how we feel is valid. Because being treated badly or unfairly because of our skin colour, race, or ethnicity, or for some other reason, it's not completely clear. It can just be a feeling that we get from someone, or it can just be noticing that we're being treated differently. It can be really hard to voice this, especially if the people we're talking to have never had to ask themselves these sorts of questions. Sometimes, even when we're convinced that we've experienced racist treatment, further kind of distress and trauma can happen from people denying our experiences. And in those cases, we might tell ourselves that we've got it wrong. That can feel very, very lonely and isolating. And remember, you're not alone, your feelings are valid, and we're here to support you in that. It's also valid that if you feel racism indirectly has an effect on your mental health. Sometimes things going on around us in the world can greatly impact our own internal world, and we can feel personally attacked when we see what's on the television, and it can make us feel helpless and out of control. So with that in mind, what are my top tips for mental health equality, and where can we start in this? So just as we're able to have a preference of the gender of our counsellor, we're also entitled to request a person of colour, and that's completely up to you and if you choose. Unfortunately, there's still a lack of representation within mental health professionals, but the service must do their best to meet your needs if you request them. I would also recommend looking out for specific BME charities in your area. So that can really bring a sense of community and bonding to share experiences of racism and how that might feel to hear other people's experiences too. And for non-BME people, listen to people of colour when they tell you their distressing experiences of racism. Call out racism when you see it and reflect on your own internal biases. We all have a lot to learn, and we need to be willing to challenge our own views and our own stigmas. I invite you guys to comment, like, and share and ask questions about this video. I think it's super, super important to keep this conversation going. And as always, if you feel like you want some mental health support from the City of Glasgow College, please go on to My City, Apps, Bookings, and click on Wellbeing Assessment, where one of our trained professionals will be able to have a 45-minute conversation with you around how we can support you. Thanks so much for listening.